You mentioned the companies and the stock prices and Mr. Gates and Mr. Fauci. You know, I guess you're talking about Moderna. What is your read on these big companies, some of these conflicts of interest with Gates and then of Fauci? And then I was surprised to learn that the CDC even owns patents. And I just assumed these three-letter organizations were completely independent. What are your thoughts in general on these?
No, they're terribly compromised. I mean, it starts with the ACIP, the Advisory Committee on Immunization Practices at the CDC. All of the members of that committee are heavily funded by the pharmaceutical companies, and they're the ones that are making decisions about vaccines that are then going to be on the schedule. They're going to be mandated for American children. And yet these people are receiving sometimes hundreds of thousands of millions of dollars from the industry on whom they're making decisions about their vaccines. It's unacceptable. You need a firewall between those who are doing the safety science and those who are benefiting from the outcome from the vaccine. But this is one of the big problems that has come about pursuant of the Act, is that there is no oversight. There is no accountability. And there is huge conflict of interest. It's rife within the American scientific community. It's rife within the UK. And yet it is allowed to continue because no one in the political arena is going to stand up to these people and take them on. Indeed, they've fallen in line because their re-election may be dependent upon the funds coming in from these industries, that they are persuaded, because they're not themselves medical or scientific, that these vaccines are life-saving and this is their duty as a politician. And they're not paying attention. They're not paying attention to all of those thousands of mothers who gather on the steps of the courthouse or of the state legislature and say, this is wrong. There is a problem. Look at this child. This is what mandatory vaccination did. And tragically, people are coming now to the realization that this is true simply by virtue of the weight of numbers. There are so many damaged children. 1 in 20 boys in New Jersey has autism. 1 in 20 boys in Northern Ireland has autism in Belfast. When I was at medical school, graduated in 1981, it was 1 in 10,000. That is an alarming number, and it will continue to rise. It will accelerate more and more as we put more pollution into these children's bodies.